The NHS Workforce Race Equality Standard, or WRES, is an important mechanism to achieve workplace equality and has several functions. Firstly, to help NHS commissioners and NHS healthcare providers review their data against 9 WRES equality indicators. Second, to produce action plans to close the gaps in workplace experience between white and black and minority ethnic staff. Third, to improve BME representation at the board level of their organisation. A WRES return is completed annually. It requires comparative information on workforce indicators for white and BME staff, and also compares national NHS staff survey data for these groups. Our WRES report is composed of several elements that together help us to plan and develop an approach to improve the work experiences of our BME staff. Progress is measured against the 9 WRES indicators, and we compare our present position with results from previous years. Our findings show that there are a number of areas where we are demonstrating progress, and some areas that present a more mixed picture. For example, we have either exceeded or matched our mandated BME recruitment targets to more senior positions. In the last year, the number of very senior managers in the Trust has risen from 0 to 3, which represents a 17% increase. However, our BME staff at bands 5 and 6, who make up the largest proportion of our BME workforce, still do not progress at the same rate and in the same numbers as their white colleagues. BME staff are also less likely to enter the formal disciplinary process. Although this counters the national trend, it is still a deterioration on our current position from 2020 to 2021. A clearer picture can be seen with our rates of appointment from shortlisting for white and BME staff. We are far closer to a figure of parity, that is to say, an equal likelihood of appointment for white and black applicants, than the national figure, and we are closer to parity now than we were in our benchmark year, which was 2018 to 2019. We are working closely with our local partners and developing a system-wide approach to overhauling recruitment and promotion practices. Rising rates of bullying and harassment faced by all staff, from managers, team leaders or colleagues, is an area where we need to focus attention, and we are seeking to address this through staff training, improved awareness of and access to our trust policies, our wellbeing service, and more accurate data collection. It is difficult to gauge whether the increase is due to added pressures imposed by the COVID-19 pandemic and/or greater staff confidence in raising issues. To improve the work experience for our BME staff, we will continue to engage with EDI leads and staff networks across the Bath, Swindon and Wiltshire integrated care system. For the first time, our action plan has been agreed with and is jointly owned by our neighbouring acute trusts. The range of issues are consistent across our organisations, and we are seeking to share best practice and resources and develop a coordinated approach.